Hi, my name is Joe.
Hi, my name is Nabil.
Hi, my name is Shaf.
And hi, my name is Tasha. So today we're going to talk about patellofemoral pain syndrome.
Okay, for the presentation, the disease that we chose is patellofemoral pain syndrome. This disease that normally happens among the athlete, commonly the young athlete. This disease happens because the development of the ligament is not well enough built, and the athlete or the young athlete go through a vigorous training program that makes the ligament is hard to be developed. Other than that, too much impact on the ligament caused by the high ground jumping or such as weightlifting, gymnastics and high jump. Other than that, it also caused by the lack of calcium and a few other minerals that support the bone growth and development, and also give a strength to the bones to grow.
I will explain about patellofemoral pain syndrome. Patellofemoral pain syndrome is a broad term used to describe pain in the front of the knee and around the patella or kneecap. It is sometimes called runner knee or jumper's knee. Patellofemoral pain syndrome occurs when nerve sense pain in the soft tissue and bone around the kneecap appear. It also called as chondromalacia patella. Chondromalacia patella is the softening and breakdown of the articular cartilage on the underside of the kneecap that can lead to the inflammation of the synovial and pain in the underlying bone.
So next, I will talk about cause of patellofemoral pain syndrome. In many cases, patellofemoral pain syndrome is caused by vigorous physical activities that put repeated stress on the knee, such as jogging, squatting, and climbing stairs. It can also be caused by a sudden change in physical activity. This change can be in the frequency of activity, such as increasing the number of days you exercise each week. It can also be in the duration or intensity of activity, such as running longer distance. Other factors that may be contribute to patellofemoral pain include 1. Use of improper sport training techniques or equipment. Second, change in footwear or playing surface. Patellofemoral pain syndrome can also be caused by abnormal tracking of kneecap in the trochlear groove. In this condition, the patella is pushed out to one side of the groove when the knee is bent. This abnormality may cause increased pressure between the back of the patella and the trochlea, irritating soft tissues. Factors that contribute to poor tracking of the kneecap include problems with the alignment of the leg between the hips and the ankles. Problem in the alignment may result in a kneecap that shifts too far toward the outside or inside of the leg, or one that rides too high in the trochlear groove, a condition called patella alta. Next is muscular imbalance or weakness, especially in the quadricep muscles at the front of the thigh. When the knee bends and straightens, the quadricep muscle and quadricep tendon help to keep the kneecap within the trochlear groove. Weak or imbalanced quadricep can cause poor tracking of the kneecap within the groove.
The syndrome of this disease is the athlete will feel dull. Other than that, the athlete will feel itching at the front of the knee. And then next is the pain usually will be feel during intensive exercise or other activity that involving bending movement at the patella. Besides that, the patient or the people that have this kind of disease will feel pain after sitting for a long time. The level of intensity and the equipment used or the activity level should be considered for this particular people, because it will cause a bad effect after the activity. Other than that, the syndromes of this disease is they will hear a popping sound at the knee after sitting for a long time or after climbing stairs. Any activity that involves too much of knee movement will they will feel the pain or hearing a popping sound at the patella.
And now, I am going to explain about my part, which is what are the patella femoral pain syndrome effects to sport performance. First thing first, this syndrome reduces the agility when we are doing sports. This is because the main part of the body in doing agility is patella. If our patella gets hurt, it will reduce the agility in doing sports. Next, the syndrome will affect the stability of our body. As we know, the main part that play the roles as stabilize the body is patella. Without patella, our body cannot be stabilized in any situation such as landing after jumping in football, walking, and running. Other than that, this syndrome will reduce the speed of our body, and at the same time, our foot movement will be limited. Patella is very important in generate the speed and movement of our foot because patella connected the calf and thigh that play the roles in generate speed and movement of our foot. Last but not least, this syndrome will disturb the athlete's mental in doing their sports. The pain of this syndrome will disturb the athlete's mental and affect their performance in sports.
Thank you for watching and listening. Bye.